Good afternoon, dear students. My name is Mohamejan Ojanaktaevna. I am an English teacher of the Department of General Educational Disciplines, and today's topic is pneumonia. During today's lesson, we will work on enlargement of your vocabulary on this theme, on improvement your reading and speaking skills, and we will revise several grammar themes. Are you ready? Let's get started. As usual, we will start with our active vocabulary. Students, I will read only in English. Please listen carefully and after finishing, write it down to your copybooks and learn it by heart. Affect, sac, due to, pus, fluid, mild, fatal, result in, complication, plural infusion, classify. Once more, affect, sac, due to, pus, fluid, mild, fatal, result in, complication, plural effusion, classify. Acquire, germ, last, inhale, traits, produce, cause, refer, resistant, occur, swallow. Once more, acquire, germ, last, inhale, traits, produce, cause, refer, resistant, occur, swallow. Excessive, arise, contagious, sneeze, to spread, illicit, phlegm, sweating, chills, shortness of breath, nausea. Excessive, arise, contagious, sneeze, to spread, illicit, phlegm, sweating, chills, shortness of breath, nausea. Vomiting, diarrhea, to prevent, to include, to calm, to relieve, severe, cough. Once more, vomiting, diarrhea, to prevent, to include, to calm, to relieve, severe, cough. Students, we have finished with our active vocabulary. Please don't forget to write it down to your copybooks and learn by heart. Before reading the text, you should do this pre-reading task. The task is matching. It means that you should match English word combinations with their Russian equivalents. For example, inflammatory condition in Russian will be воспалительное состояние. To be critically ill, быть серьезно больным. I hope this task is clear for you. Please do it in written form. The grammar theme of today's lesson is degrees of comparison. As you know, there are two degrees in the English language, comparative degree and superlative degree. One syllable adjective like fast, young. When we make comparative degree, we add er, and in superlative degree we add est. For example, faster, the fastest. If one syllable adjective ending in e, in comparative degree we add only r, and in superlative degree we add only st. For example, nicer, the nicest. If one syllable adjective consists of consonant plus short vowel plus consonant, like big, hot, in superlative degree and in the comparative and the superlative degree, the last consonant will be doubled. For example, bigger, the biggest. Two syllables ending in y, like happy, crazy. In this case, we change y into I, and in comparative degree it will be happier, and in superlative degree the happiest. If our adjective consists of two or more syllables, like famous, beautiful, we don't add er and est, we add more in comparative degree and the most in superlative degree. For example, more famous, the most famous. And as usual, we have exceptions, yes? Common exceptions for goods and bads. In comparative degree, good will be better, and in superlative, the best. Bad will be worse, and in superlative degree, it will be the worst. Here you have 4 sentences, students, 2 in comparative degree and 2 in superlative degree. Your task is to translate them in written form into your copybooks. The next task, the next grammar theme is passive voice. Yes, you know that there are 2 voices in the English language, passive voice and active voice. When a sentence is written in active form, it means that subject performs an action. And in the passive voice, the subject receives the action. The passive voice is formed by to be in auxiliary verb to be in correct form and past participle. For example, the air sacs are called alveoli and may fill with pus or fluid, making it very difficult to breathe. This is usually caused by respiratory viruses such as those that cause colds and flu, especially in young children and older people. Again, students, please translate these sentences into your own language using passive voice. The next grammar theme is construction both and. Both and means that each of 2 things is true. I would like both to buy a new house and purchase a new car. It means that someone wants to buy a house and a car. Yes? Also, students, you have 2 sentences, yes? And as usual, please translate them into your own language using this construction. Now let's turn to our text. Pneumonia, general explanation. Pneumonia is an inflammatory condition affecting the air sacs in one or both lungs, most commonly due to infection. The air sacs are called alveoli and may fill with pus or fluid, making it very difficult to breathe. Many germs can cause pneumonia, but the most common are bacteria and viruses in the air we breathe. Pneumonia affects approximately 450 million people globally, resulting in about 4 million deaths per year. Pneumonia may range seriously from mild to fatal. It is generally more serious when it affects all the adults, infants and young children, those who are critically ill and those with a weakened immune function. Also, it can occur at any age. Pneumonia is more common in elderly people. Pneumonia can result in complications such as sepsis, lung abscess, and pleural effusion. The major types of pneumonia are classified according to the types of germs that cause it. Types of germs. Bacteria. The most common cause of a bacterial pneumonia is a Staphylococcus pneumonia. These types can occur on its own or after a cold or flu. Viruses. This is usually caused by respiratory viruses such as those that cause colds and flu, especially in young children and older people. Viral pneumonia usually not serious and lasts for a shorter time than bacterial pneumonia. Fungi. Fungi found in soil or bird droppings can cause pneumonia in people who inhale large doses of the organisms. Mycoplasma. These organisms are not viruses or bacteria, but they have traits that are common to both. Mycoplasma pneumonia produces milder symptoms than other types of pneumonia. Types by location, where the infection was acquired. Community-acquired pneumonia, CAP, refers to pneumonia that is acquired outside the hospitals or other healthcare institutions. It is the most common type of pneumonia. Hospital-acquired pneumonia, HAP, refers to pneumonia during a hospital stay. This type of bacterial pneumonia can be more serious than other types because it develops in people who are already under medical care for another condition, and because the bacteria involved may be more resistant to antibiotics. Types by how the infection was acquired. Aspiration pneumonia occurs when an individual inhales bacteria into the air from food, drink, vomit, and saliva. Ventilator pneumonia arises from being on a ventilator for respiratory supports in an intensive care setting. Most kinds of pneumonia are contagious. Anyone can be infected, but certain people are at high risk. People older than 45 years, infants from birth to age 2 years, people with a weakened immune system, people who smoke, drink excessive alcohol, or uses illicit drugs, people with chronic conditions such as asthma, diabetes, heart failure, cystic fibrosis. Symptoms: fatigue, fever, cough. A cough may produce phlegm, sweating and chills, chest pain while breathing and coughing, shortness of breath, nausea, vomiting, diarrhea, low body temperature, especially in older adults and people with weakened immune system. Diagnosis and treatment. The doctor will review your medical history and carry out physical examination. During the physical exam, the doctor will listen to your lungs with a stethoscope to check for abnormal bubbling or crackling sound, which may be suggestive of pneumonia. If pneumonia is suspected, the doctor will recommend blood test, chest X-ray, sputum test, urine test, CT scan, and pleural fluid culture may serve as an additional diagnostic test for people who are older than 65, are in the hospital, have serious symptoms or health conditions. Treatment depends on the severity of the pneumonia, your age, and overall health. If symptoms are severe, hospitalization may be recommended. Okay, students, we have finished with our text, and in order to check your understanding, please answer the following questions. First, what is pneumonia? How do you get pneumonia? What are the types of pneumonia? What are the signs and symptoms of pneumonia? Who at a high risk of getting pneumonia? Is pneumonia fatal? What test will your doctor order to confirm pneumonia? Is pneumonia contagious? How is pneumonia treated? What can you do to prevent pneumonia? Also, students, the following task also in order to check your understanding, yes, of the text. The task is true or false. You should decide whether the sentence true or false. If the sentence is false, you should explain why. The first is, pneumonia is not a dangerous disease. Please say, is it true or false? Only elderly people can suffer from pneumonia. Pneumonia can lead to complications. Properly untreated colds or flu can result in pneumonia. Both viral and bacterial pneumonia are not serious and last for a short time. Symptoms of mycoplasma pneumonia are milder than the symptoms of other types. Treatment of pneumonia depends on many factors. People who are already under medical care cannot acquire pneumonia as they are resistant to bacteria. Students, you should do this task in written form, and Again, if the sentence is false, please explain why. And the last task, it will be your home task. Retell the text according to the plan. The first is, what is pneumonia? The second, types and causes. The third is, symptoms. And the last is, how pneumonia can be diagnosed and treated. Our lesson is over. Thanks for your attention.